Hi, my name is Karina Becker, and I'm a first-year nursing student at the University of Michigan. The patient I assessed is a 94-year-old Caucasian female. She is a widow with 6 children, but the patient was unable to provide any additional family history due to her late-stage Alzheimer's. She is a retired clerical worker who was living alone prior to admission, with Medicaid covering her care. Her chief complaint is confusion and long-term care needs. For vital signs, the patient has a respiratory rate of 18, a pulse of 80, and a blood pressure of 108/56. The patient was brought into St. Joseph Mercy Hospital on August 6, 2014, with severe malnutrition after Meals on Wheels found her bedridden and unable to answer the door. Upon entry to the emergency department, the patient was experiencing unlocalized abdominal pain and tenderness due to constipation. Her labs showed extreme malnutrition as well as dehydration indicated by low protein, albumin, caloric intake, glucose, and sodium. In addition, the patient weighed just 75 pounds at that time. 3 days later, she was transferred to Heartland for extended care and has been eating regularly and drinking a caloric-rich house shake 3 times a day ever since. In terms of neurological status, the patient was experiencing confusion upon entry to the emergency department, and suspected dementia was later confirmed through multiple neurological assessments at St. Joseph Mercy Hospital. Although it is difficult to tell when the dementia and related malnutrition began, the patient's dementia has worsened over time. The initial mini mental state exam administered to the patient was scored at 12 out of 30, but the score has since declined at a 7 out of 30. Additionally, the patient is not currently taking any medications to slow the progression of her dementia. The first system I assessed, which was also the most important system to assess, was the neurological assessment. The patient does not have a history of seizures, head injuries, insomnia, or difficulty speaking. However, there were concerns about her memory, ability to concentrate, balance, and anxiety with daily activities. For the assessment of her neurological status, I performed the Folstein's mini mental state exam. The patient scored a 7 out of 30 on this exam and was unable to perform any of the memory or orientation tasks, apart from identifying the city and state as Ypsilanti, Michigan. The only other tasks she was able to complete were following the written task, close your eyes, and identifying a pencil and a watch. In addition, she was able to follow part of the verbal command, putting a piece of paper on the floor without folding it in half. Throughout the exam, the patient verbalized that she could not remember anything. The patient was unable to stand for gross motor functioning and Romberg tests, but her fine motor functioning, though a little slow, was mostly normal. Her light and painful sensation were normal, but the patient had trouble with the stereognosis and graphesthesia tests. The second system I assessed was the integumentary system. The patient was not experiencing dryness, rashes, or other problems with increased sun exposure. The patient's scalp was not flaky and her hair was white and coarse. The patient's skin was extremely thin due to her age, as well as moist and oily. In addition, the pigmentation of her skin was blotchy and purple in places, again related to her advanced age. There was no palpable edema, but her skin was extremely elastic with very low turgor. I chose this assessment because the patient is at a moderate risk of pressure ulcers at a 15 on the Braden scale, with moist skin in a wheelchair. Another system I would assess is the musculoskeletal system due to the patient's weakness and lack of independent mobility. A journal written by Christine Arenson and Associates at Cambridge University in 2009 demonstrated the high risk for falls in the elderly due to decreased muscle strength. In their research, they discussed the increased risk for injury in Alzheimer's patients due to their lack of orientation to place and overall confusion. The final system I would assess is the abdominal system due to the patient's initial complaints of abdominal pain due to constipation related to her malnutrition. According to a journal by Maurice Shils and other researchers on nutrition in health and disease in 2006, malnutrition is likely to be related to an underlying disease. The primary diagnosis of Alzheimer's in my patient reflects this concept, as my patient was forgetting to eat due to her dementia. This lack of nutrition eventually led to her abdominal pain, which first brought her into the hospital.